everyone, Dr. Fruver here. So today I'm going to be talking about situational judgment testing, and specifically the situational judgment test being developed by the AAMC. Yeah, the guys who brought you the MCAT. So we're going to be going over what is a situational judgment test, why you should care, the pros and cons of the test being developed by the AAMC, and finally what you should be doing to prepare for your situational judgment test. So what is a situational judgment test? So situational judgment test is actually an umbrella term that we use to describe all those tests like the MMI and the Casper that you're probably familiar with. So basically the applicant is given a hypothetical scenario and asked to reason around it using their problem solving and communication skills. These tests are being used by medical schools in response to the changing environment in which we are practicing medicine. So as medicine becomes more collaborative, as the patient population becomes more diverse, we need students with strong communication skills, strong interpersonal skills, and who are capable of dealing with patients from, a diverse variety of social cultural backgrounds. So that's basically what the situational judgment test is about. So why should you care about the situational judgment test? So the AAMC has been developing this test, and it's not set to release until 2019. However, they have been rolling it out at a handful of schools within the states for testing purposes. So far, it's essentially like a non-cognitive version of the MCAT. So it's a test you take that's submitted with the rest of your application package, like your MCAT, your GPA, your letters, and it's used by the schools to weed out who they're actually going to interview. So this could impact whether or not you're actually going to get an interview. For the AAMC's preliminary research, the one school that they looked at, it changed the composition of the matriculating class by 18%. So that's huge. So this test could really determine whether or not you actually get into medical school. Further, the test is looking at personal skills. 98% of admission committee members, according to the AAMC again, rate personal skills as important or very important in their medical school applicants. So the test, it's really going to inform whether or not you actually get into medical school. So you should be keeping an eye on its development. So what are the pros and cons that I see associated with the test? So in terms of pros, so the test has a lot of potential. It still does need more research, but situational judgment tests have been found in the past to correlate significantly to an applicant's clinical performance and professional skills. So this is important for the medical schools because they know that it's easier to rehabilitate a student from an academic lapse than it is from a professional lapse. Students who have recurrent professional lapses often tend to have to be discharged from the program, and schools want to choose students who are going to be successful. Second, it may help to create a more diverse group of students. So we know from past research that students from underrepresented racial groups within medicine tend to do more poorly in terms of their GPA, their standardized test scores, their research, and their experience because they just have less access to resources. So depending on where you're coming from, you maybe don't have access to an MCAT prep course. So theoretically, if this test was included in the application package, it could improve the chances of these students actually getting into medical school and could result in a more diverse group of medical students and future physicians. Finally, it may actually outperform the traditional interviews we use or personality tests. Again, research in this area still needs to be done. So what are the main cons that could be associated with this test? So first of all is the obvious thing that more research needs to be done to determine whether this is actually going to improve the quality of our medical students and our future physicians. Is this going to help society as a whole? Second is the cost to the students themselves. The cost of applying to medical school is already astronomical. And is this just another test, another add-on thing that you guys are going to have to be paying for out of pocket? Some people might see it as another cash grab by the AAMC. Finally, it's just one more thing you guys have to prepare for, another thing on your plates, adding to the stress of pre-med students. So what should you guys be doing to actually prepare for this test? So I have two pieces of good news for you. So the first one is that the AAMC has confirmed that the test is looking for those same 8 pre-professional characteristics that have been emphasized by medical schools over the past couple years. For those of you who don't know, so we've got service orientation, cultural competency, ethical responsibility, reliability, dependability, social skills, teamwork, resilience, and capacity for improvement. These are the same skills that you guys have been working on through your volunteer work and your other resume building. It shouldn't be a change there, so there's no reason to panic. The second piece of good news that I have for you is that BMO has found situational judgment testing is highly coachable. Through our experience working with students, we've seen significant improvements in students who receive professional feedback during their MMI and CASPER tests. The same is likely to apply for situational judgment testing. No matter what happens, we're going to have the strategies to be able to teach you the behaviors and the skills that you need to be able to be successful at this test and get into medical school. So let me know, what do you guys think of situational judgment testing? Is this the future of med school applications? Is it going to improve future doctors? Or is this just another cash grab by the AAMC? Thanks for watching the video. If you enjoyed it, don't forget to subscribe to our YouTube channel. We post a new video every week. Have a good week, everyone.